Hello everyone, it's lovely to see such a large number of people here today. We're delighted people have turned up, which we can't always guarantee, but I think we've got at least 150 people in the room and about 80 people online. So this is wonderful to have so many of you here today. It's a packed programme. I think it looks fantastic, so I hope you'll enjoy it as much as I will. I'm going to give you a very brief update about what's been happening with the Neuroprogressive and Dementia Network. I've started putting my potential conflicts of interest on slides. I think we need to start being tighter about these than we have done. I don't feel I've got any that are concerning, but you can make your minds up about that. I'm going to give you a bit of an update about what we do. Some of you might not know who the NHS Research Scotland Neuroprogressive and Dementia Network are. It's a bit of a mouthful, the name. We are looking for a new name. We want a catchy, short, exciting something or other. So if any of you have that talent, let us know, and we would love to hear from you. If you've got that kind of mind, we want a new name. But we are present at the moment in every mainland health board in Scotland, and we do clinical research everywhere. We are starting to explore engaging with people in the islands, because why should you miss out because you live on an island? And I'll say a bit more about that. I'm going to talk about our partnership working with charities, particularly Alzheimer's Scotland. I'm going to talk about our research interest register, permission to contact. We maintain a balance of commercial and academic studies, and it's important to have that balance because the commercial trials bring in income, which is then recycled to pay for staff. So none of us receive individual payments from pharmaceutical companies, but the NHS does, and that allows us to employ more staff and to do more research, which also allows us to run academic trials, which are equally, if not more interesting, but which are often run on a shoestring. We have a broad portfolio of conditions that we do research in, so all types of dementia, but also neuroprogressive conditions, which is the umbrella term that we use for Parkinson's disease, motor neuron disease, multiple sclerosis, Huntington's disease, CJD. And I won't have time to tell you about the Alzheimer's Scotland Dementia Brain Tissue Bank, but we run that in partnership with the University of Edinburgh. So anybody does have to be mainland Scotland who wants to donate brain tissue, if they have a diagnosis of dementia, can do so. So we, three of us were recently in the, we're in the Western Isles and the Northwest Highlands, trying to drum up support for research, and we were delighted with the welcome we got and the interest there is in taking part in research there. So we're finding about some of the barriers and some of the opportunities, and certainly some of the studies that are beginning to come through may well be possible to run in these places, which would be hugely exciting. Last year we had a similar visit to Shetland, and again they were super keen, and they had a can-do attitude. They even said we'd have a whip round to pay for people to get the boat if they wanted to go to Aberdeen to do a study. So we're doing what we can to engage people everywhere in Scotland, because we feel that everybody should be offered the opportunity to take part in research. Rosie's speaking in a moment, so I won't say too much about Partners in Research, but I'm so proud of everything Rosie does and everything our Partners in Research do. This is our lived experience group, and they chose the name Partners in Research, which I think describes exactly what they do. Rosie will say more about their activities, so I won't say more, but I will highlight the book that a number of them wrote, which was published and launched just 5 minutes along the road at the V&A. There was a fantastic event there. And it's published as a beautiful, real hardback book by Springer, a real academic publisher, but it's also available open access. So if anybody wants to download it, you can go to the publisher's website and download a copy of it for free. It's fantastic. And it's been a great success. I think it's about 7 billion downloads at the last count, something like that. I think I checked this morning. I wrote a book last year as well, which I'll mention because it's one of the few books for people with dementia which has a chapter about research. The feedback has been really good about it, but the reason I mention is it's one of the 20 books on the new Reading Well for Dementia list for libraries in England and Wales. So all libraries in England and Wales have to have these 20 books in, all of which are fantastic. Well, 19 of them are fantastic, and there's mine. But we're also speaking to libraries and other organisations in Scotland to see what we can do. And I think some of you have got some bookmarks, which have got at least pictures of the 20 books on there. And this is a picture of me at the House of Commons on a very warm day last month for the launch of the list. I think it's a fantastic endeavour, and I think nobody should have to buy a copy of the book. It should be available in every library for everybody. So don't buy a copy. Go to your library and request it. We really value our relationship with Alzheimer's Scotland and with all the charities we work with, but because of our historical origins as the Scottish Dementia Clinical Research Network, Alzheimer's Scotland is the organisation that we work with most closely. And over the last couple of years, we've been very proud to work together with them to develop this education programme for all of the staff of Alzheimer's Scotland called Confident Conversations About Research. This is because Alzheimer's Scotland are the people who support people with dementia following a diagnosis. The work they do is absolutely super. And one of the things that people who have a diagnosis of dementia or even mild cognitive impairment might like to know about is research. And Alzheimer's Scotland staff know a lot about dementia and supporting people with dementia. And some of them know a lot about research, but not everybody does. So we designed this day's training, which we've delivered to, I think, almost 200 people. All of the post-diagnostic link workers, the dementia advisors, to help them have confident conversations about research with the people that they support. It's not to make them experts, not to make them familiar with every study that's happening at the moment, but just allowing them to have that conversation if somebody wants to. The feedback has been really good, and I can say that because I've hardly been involved in delivering the sessions after the first one or two. And one of the feedback was that they wanted something, a toolkit that they can just suggest to people. So on the back of that, we created this it's a little postcard, even though you can't see that on the picture, which has got the 5 main opportunities open to somebody with dementia who wants to take part in research. And we're now having requests that NHS teams want the training as well. So we're starting to deliver it to NHS clinical teams who similarly know a lot about dementia and the conditions in the people that they support, but maybe not so much about research. I mentioned our research interest register. There are many research interest registers. I think they should all overlap, and there shouldn't be any wrong way into research. And we do our best to make sure that nobody gets into a register and then misses out on any opportunities. But we've had this paper version for a long time. It's now available online. If anybody wants to be techie, you can scan that QR code and it'll take you straight to the NHS Research Scotland website where somebody could sign up. The reason it took so long is that the database is really securely held within the NHS firewall by the Health Informatics Centre in Dundee, so the data are secure. And I think at the latest count, we hit 600 people in Scotland who'd signed up saying they were interested in taking part in research in all our conditions, which is something to be hugely celebrated. And similarly, I must mention Joint Dementia Research who aren't here because there's something happening in Westminster in the next few weeks, I don't know, which means that they're not allowed to engage in these things. But we very much promote Joint Dementia Research and try to co-enroll people. So when they sign up with us, we ask them if they'd also like to join Joint Dementia Research, and vice versa, the similar thing happens. The picture here has now become the UK because one of the really exciting developments is that we're joining in with a lot of the really big studies that are happening UK-wide now. In the past, we weren't always invited to join these, but that's starting now that we're being invited, and it's a great privilege and joy that we are. So the map's now the whole of the UK. And I can say it because it's not me that does it, because I'm very grateful to all of our staff. The clinical studies officers across the country are absolutely fantastic. Jackie, our network manager, Emma, our strategic manager, and particularly Helen, who's our fabulous administrator, who's been wonderful in organising this. It wouldn't have happened without her. The staff are fantastic and they're great at doing clinical research. So in the Luma trial, we were the top recruiters in the UK. In NHS Tayside alone, in one health board, there's almost 200 people recruited to the ROPAD study. We were the first people in the UK to screen people for the CAN PDP trial recently, and we're starting to contribute to platform trials. And you'll hear more about the latest with MND Smart from Samanka Pala a bit later, which is very, very exciting. But that model is being rolled out to other conditions. And tomorrow you'll be hearing from Paresh Malhotra from Imperial College about the plans for the Mastodon AD trial, which is a similar model, a platform trial in dementia. We're really looking forward to welcoming the European Alzheimer's Disease Consortium to Edinburgh. So it'll be about 100 really of the most significant researchers from across Europe in the field who are coming to Edinburgh in October 2025. So we're on the lookout for a piper if anybody knows anybody who'll pipe for free. But another really exciting thing that you'll hear more about tomorrow from Vanessa Raymond, who's coming, are the blood-based biomarker studies. She's running the READOUT study from the University of Oxford. There's also the ADAPT trial from UCL, both of which were announced recently, and we're taking part in both of those. And excitingly, I think some of these are the ones that we could potentially even run at the Western Isles and the other islands. So it's exciting times for research in Scotland. There's a lot to celebrate. I mentioned the blood-based biomarker trials. You might have seen the coverage in the BBC News. It was everywhere. Really, really exciting stuff. But it's an exciting time in general. I'm excited to be here. I'm delighted to see so many of you. And I'm looking forward to a couple of really exciting days. So thank you very much for your attention.
Can everyone hear okay? Woohoo! Right, this presentation makes us nervous because it's mainly a video, but we're going to hope for the best. Thank you for the lovely summary too, Tom. That was very kind of you. I'm Rosie, and I'm just going to talk a little bit about the patient and public involvement work we do with the Neuroprogressive and Dementia Network and a little bit with Enrich Scotland. As a background, I thought I'd put some of the projects that I've been involved in up till now, because I think the co-research that I've been able to do has massively influenced the direction that we've gone with partners in research, particularly from a co-research perspective. And my background is psychology, but some of the projects also link in with the other work of Edinburgh Uni. So there was BUDS, which was looking at diagnosis during COVID-19, and the Smarties, which was an Edinburgh University PhD looking at volunteering in dementia. Ooh, fab. Okay, so just to summarise what the two groups do, the first half of the slide is the work we have with partners in research, and it's talking about we have 3 different group options at the moment if you're interested in joining. It is open to everybody, but the focus is on people with lived experience of dementia or the other neuroprogressive conditions that we're going to talk about today. We have a monthly drop-in because we think it's very important just to have that space to chat about whatever topic people feel is affecting them at the time. I think the last one included lots about where to go for a nice lunch in Dundee, but there was also other bits about their kind of everyday that they were finding difficult. And that space, I think, when we're asking so much of people in research, it's really important to have that space. We have the more traditional PPI drop-in groups, which is where researchers submit the research they're doing and ask for input from our partners in research, and we're able to give feedback. We're really keen that if you do want feedback from people with lived experience on your work, that you come and present to the groups so that they have the opportunity to have that back and forth with you in person. And then finally, we have the co-research that we're doing. At the moment, that links in with post-diagnostic support for people with dementia, and it also links into work we're doing with people with Parkinson's. And one of our partners in research, Stephen, is going to talk a wee bit more about that tomorrow afternoon. Yeah. But a huge part of what we've tried to do, and as Tom said, that with the book, was about providing a platform for people to tell their stories, because so much of what we know is that people want to be heard first, and then we can look at how we can support them in research. The other side of that, the slide you've got there, is the work we're doing with Rich Voices. So Rich Voices stands for Research in Care Homes Voices. And like Partners in Research, it was the group that named themselves. And we thought that was a really important part of their identity as a group. We then focused on what activities people would like to see from patient and public involvement in care homes. It's a different setup to Partners in Research. Partners in Research has largely been through online meetings. That's not particularly feasible for care home research. There's a lot more need to be there in person and going to these different places. But we've managed to set up a podcast that will be hopefully released very soon. It was recorded a while back that talks about research in care homes and opportunities. We co-created a film about research in care homes. We've also, a big part of what we've just been doing has been about creating an accessible research platform, which is a fancy way of saying we've updated the website to try and make sure that the information on it is much easier for people to access, particularly in terms of finding out about what other research is going on in care homes, but written in an accessible way. So we have the option for researchers to submit their lay summaries of their work that they can put through systems that help you to write a more accessible summary. And these are then going to be available to care homes to see. So seeing as you don't really need to hear from me when it's about the people with lived experience, we have a video that's just a handful of our partners in research talking a bit about why they get involved. And it starts with David, who I think is also in the room somewhere. There we go. So we'll fingers crossed that this works, because it's better from them.
I'm David. I'm a retired engineer, and I was a carer for my late wife. And the reason I joined Partners in Research was because there wasn't any answers available to me initially, and I had to find out, and that's why I joined.
I'm Maureen Corsa. I have personal experience of caring for somebody with dementia. I also have that professional experience as well, and that's working in health, but also now working within the care inspectorate and having that focus on dementia. And I heard about this group and wasn't too sure what to expect, but I think it's been absolutely great.
Hi, my name's Winnie, and I'm a retired psychotherapist and counsellor. I was a carer for my husband who had dementia and who has sadly passed away now, because my husband always knew he had dementia from the very start and would talk about it and would try to promote it, which is really what I'm trying to carry on. Partners in Research was my go-to place.
Hi, my name's Fiona. My route into the group is maybe slightly different in that it first started when I signed up for the share system of getting your name put forward for research. And during that, you also got asked if you wanted to be in Partners in Research. Sadly, during that time, my mum got diagnosed with Alzheimer's, and as time went on, I ended up caring for her, and some of the journey was not smooth going, shall we say, and she passed away last year. Very passionate about the different aspects of her care that weren't as good as they could have been. The support that the group has given personally has been great through difficult times. But I've also enjoyed challenging my little grey cells themselves, which I think it's good for me mentally to keep myself focusing and thinking and learning. And some of the projects that we've been involved in, you feel you've been a value member of these teams, so you still get a feeling of self-worth. Even when we were going through very difficult times, there was still something positive that we could achieve.
The thing I've enjoyed most about it is meeting other people with the similar situations, similar problems, and understanding how they dealt with it. I mean, I was given the phrase in the beginning, everyone is different, which I still hang on to, and I find that everyone is different. There may be similarities, but there are huge differences, and these differences are the things that are important in research to find out why people are different, and maybe at the end of the day we'll find a cure by understanding why all these differences exist.
I've enjoyed the activities that have led from the core group, so the things that we've got involved in out with this PPI group itself. We also have been providing training, or the talk about getting more education for people to understand how to read papers or etc. if that's what you're interested in.
For me, it's about when we're hearing about research proposals coming in, actually being able to speak to people right from the very start and being able to pose questions that they've maybe not thought about. So I think each of us comes with our own experiences, and we encourage the people who are producing the research idea to consider other aspects of it. Sometimes that's based in what ideally you'd like, and then what's realistic as well, and how that would impact on the people that would be taking part.
Everyone is welcome, and they don't need to have any particular level of education. It's the lived experience that we're looking for.
I still think we have a long way to go. I still think there are barriers, academic barriers, if you like, that prevent us from doing certain things. But, definitely, I think that more people are now aware that lived experience should be shared, and shared academically.
Being given this great opportunity to question people right from the start and ask about what their research offers, I think is useful for us. And it's really that directness that we can have asking the initial questions and then receiving more information on it is great from our perspective, and I think allows us to help influence what's happening.
It's grown in such a way that I never ever expected when I went into partners in research, and sometimes I've got to shake my head in disbelief and think, am I really doing that?
We can do more than just sit and go, aye. I looked after my mum. You know, we can make changes, and I think it's empowering us to do that as well.
But I think just seeing when the researchers come in that they really do appreciate what what we're offering, what we've got to contribute to, and I think that's really encouraging because I think it's absolutely the way forward. I always leave every single group feeling encouraged and know how that I've learnt from each of you as well.
Partners in research is not about people taking part in clinical trials, testing medication, etc. It's about expounding your lived experience, what you have seen, what you have observed, and what you can pass on to others who may not be aware.
I wasn't sure what I was going to be able to bring to the group or if my contribution would add anything, but know how I feel as if I'm part of that group. So I think coming in and being a bit hesitant is okay.
I know some people will be scared to get involved. They may think it's going to take up too much of their time. They may think they're going to be guinea pigs or whatever, but they're not. They're just passing on experience, and that's what's important.
And I also like the fact that we're always offered, if there's areas that we want to learn more about, that know how that we don't feel confident in, that we can, that's going to be given to us so that we can feel as confident as possible.
It's a level that you are comfortable with. You're not forced to do anything. You're out with your comfort zone. There's a place for everybody, I would say.
If anybody is a bit curious and would like to come along just to even see what it's about and get a feel for it, that they'll be more than welcome. And I think the more people that join the group and bring their own contributions, the better it'll be. So don't be frightened, just come along, give it a try. If you don't want to come back, that's fine, but I'm sure you will.
So as you can see, the big focus of that video is really to highlight that people like being involved, but also we're really keen to hear from new voices and want to make sure that people who haven't been involved before feel welcome to come and give it a try. And as Maureen says, hopefully you will come back. Not sure she's saying it's fine if you don't. But also just to highlight that, you know, we do this because we know how important it is to involve people and the difference it makes to the work we do and the research that other researchers are doing. And if you can go to the next one. And just to summarise again, the key projects we're doing, one is looking for people with experience of dementia for post-diagnostic support. One is around Parkinson's and support for clinical trials, particularly people who have been in a clinical trial and it's kind of ended and there's not a next step for them. And then the work we're doing to get to know care homes across Scotland, and Susie will be saying a wee bit about that in her presentation. There's obviously challenges we need to acknowledge. I'm very, very lucky that the network have really prioritised patient and public involvement and so funded my time in that. And it shows how much you can do when there is dedicated funding and how important it is to get that funding and support for this type of work. But we're really keen to hear from other voices, particularly some of the other neuroprogressive disease areas, as we know that partly from the background of the network, we're quite skewed towards dementia or have been, but actually there's lots of other experiences we'd like. And also it's about making sure that researchers have appropriate support and people doing this work, because you do hear a lot of difficult experiences and it's important to make sure you look after yourself as well as others. So what next? We really want to try and improve people's understanding of co-research within the academic community and make sure it's recognised for what it can contribute, and also to make sure that being involved as a researcher in co-research doesn't necessarily mean you also don't have lived experience. And we need to be careful that there's not an othering there between lived experience and the researcher, because we're really trying to narrow that gap. and just some load of QR codes in case you're interested in finding out more. So there's one about becoming a partner in research. We've got asking for help if you're a researcher looking for support, the QR code to the book. We're not quite at 7 billion, but I think we've got a good over 10,000 downloads, which is excellent. And we're really pleased that so many people have supported that. And on the other side, we've got information about Rich Voices. I think that's everything.